Be Told podcast. My name is Erica, and this is Brandy.
Hey everybody, my name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I have been practicing in the dental field for the last 20 years.
Yay! And I have not. I am just here to be one of you guys.
There we
so
go.
this is it's the first time you guys are joining us. Our podcast is focused on serving the underserved and underprivileged, particularly people of color, with the information and tools to help them have a better dental health care experience.
That's the plan.
Yep. Yay. Okay. All right. So last week we did an episode about wisdom teeth.
Yep.
And we had to do a two-parter because a lot to talk about when it comes to wisdom teeth. So on this episode, we're starting off with the risk and benefits of getting them removed.
Yes.
All right.
Yep.
So, Brandy, please tell us.
Yes. Here I am.
Okay.
So, some of the benefits of removing your wisdom teeth. Okay. So, we want to avoid things like gum disease, especially in those areas surrounding the wisdom teeth, the gums and the bone there. Any tooth decay on teeth that are nearby to the wisdom teeth. So, the adjacent teeth, the teeth right next door, um, and of course, damage to those neighboring teeth as well. Any bone loss or any jaw damage. So all of those things will kind of avoid those by removing the wisdom teeth if they're in a precarious position.
Precarious.
Precarious.
$10 word.
Yes.
All right. Okay. So, what are the risks and complications of extraction?
All right. So whenever we remove wisdom teeth or any tooth, there can be issues with dry socket, as we mentioned on the last episode. And dry socket is just a loss of the blood clot, and it results in exposure of the bone. The bone has millions of nerve endings, and so it can be an extremely painful experience. Also, you can have damage to other oral structures, including your jawbone, the nerves, the sinuses, the nearby teeth, and there can also be infection as well. And all of these things are rare, just so you guys know.
Okay. I was like, like I was like,
It's going to happen often, but it has happened and can happen and will happen, but very rarely. You know what? I forgot to mention when we said that the nerves can be damaged. So I just want to point out that this is typically on the lower jaw. So when you have lower wisdom teeth removed, there's a nerve that spans the jaw. So from here to the middle here, and that nerve supplies feeling to the lip, chin, and tongue on either side of the mouth. So you have one on both sides. So the nerves are sometimes can be wrapped around the roots of the wisdom teeth, or they can be very close by, and you can lose feeling or taste on the lip, chin, or tongue on whichever side that wisdom tooth is being removed from.
okay. How long does it take to recover after wisdom teeth removal?
Okay. So it can take, up to 1 to 2 weeks. But you will have the most discomfort in the first, it'll peak day 3, day 4. And that's when you'll have most of the swelling as well. So you'll use the ice the first couple days.
What's the worst day of pain after wisdom teeth extraction?
So yeah, it'll be days 3 to 4.
Okay.
They'll probably be the worst days. Days
Okay.
3, day 4, just about. Yeah, give or take.
Okay. Now, back on track. How long after
Mhm.
wisdom teeth removal can you eat?
So you can eat and drink right away, but it's about what you can eat. So they're going to have you eat cool, mushy foods, things that you can basically swallow without chewing. So your pudding, your yogurt, your ice cream, your smoothies, milkshakes. If you have anything like soup or oatmeal or mashed potatoes, everything has to be lukewarm. You don't want to eat anything hot because, of course, you just had surgery in the area, but also if you're still numb, you're not going to know if things are too hot for you to have. So you could burn yourself. And of course, you don't want to chew anything because you could chew your lip, cheek, or tongue when it's numb. And you won't know until the numbness wears off because you can't feel it. So you will be on a soft diet probably for the first 3 to 5 days. I usually say a week because that's a good time. So soft diet.
And
So
remember, guys, you can't eat any of these things with a straw. Like a smoothie, no straw.
You'll use a spoon, or you can just drink it out of the cup.
Yeah. When can a patient go back to school or work?
Maybe if you're having all 4 impacted wisdom teeth removed, yes, probably like 3 days or so.
When do you call the doctor if you're having some issues?
Okay, yeah. So like if you have a fever, anything over 102, if there's any kind of excessive bleeding, any severe pain that is not getting better with medication, any difficulty breathing, if you're having a hard time swallowing, if the swelling gets worse, particularly after 3 days. So your swelling is going to peak 2 to 3 days after, and then it should decrease after that. And so is your pain. Your pain is going to peak 2-3 days after, but it should progressively get better after that. If you're having severe pain and swelling after that 3rd day, then you need to see the doctor. If you have an infection, if you have any pus coming from the surgical site, those are all reasons why you would call the doctor, and they may have you come in so they can take a look. There you go.
What's the average age to get your teeth removed? That's a good question.
Okay, so yeah, the average age is probably 17 to 25, although there is no age limit. Some people have issues with their wisdom teeth well into their 30s, 40s, 50s, sometimes even older.
Oh, that's not good for me.
It just depends. Yeah, it just depends on the patient. But I mean, most people get them when they're younger. Most people get them between 17 and 25.
Okay. This is the big one. Cha-ching. What's the cost?
Okay, so the cost is going to depend on your insurance. But the good thing is that wisdom teeth, if you have what is known in the dental world as full bony or partial bony impactions, those are covered by medical insurance. So it's the only time you'll be able to use medical insurance in the dental field is at the oral surgeon's office. You cannot use your medical insurance at your regular dentist office. So if you're getting your wisdom teeth removed at your general dentist office, which is just fine, you will not be able to use your medical insurance. You can only use that at an oral surgeon's office, just so you guys know. And the medical insurance will typically cover your IV or general sedation. So if you're going to sleep, it will cover that, as well as the actual tooth extractions, only if they're full or partial bony impactions, meaning partially or fully covered in tissue and bone. If you have any wisdom teeth that are fully erupted, meaning you can see them in your mouth, they've come all the way through the gum and bone, your medical insurance is not going to cover extractions of those. That will be covered by your dental insurance. So it's just a good note because I know a lot of people don't know that.
Okay. All right, guys. Thank you so much for tuning in about wisdom teeth.
Yes.
Yes. And make sure that you go to our website, truthbetoldpodcast.com. It has all the links to all of our socials. And Brandy?
Yes, please, like, comment, share, subscribe. If you guys have any questions, you can always hit us up in the comments or go to our Instagram page at Truth Be Told Podcast and send us a DM.
Yes, and Brandy will answer all your questions because she is the authoritative person on these things.
The authority.
Not the authority. Not me. I just go to the dentist. All right, guys. Check you out next time.
All right, take care.